Getting sick is never easy, especially if you're a student. No student would ever admit it, but missing classes isn't exactly enjoyable. There's work to catch up on, taking a day to visit the doctor, and it can really throw a wrench into your gears. This doesn't just apply to students, but parents too. Last spring, the Bristol, Tennessee school system launched the Bristol, Tennessee School Health Center to help.
We've developed a partnership through our strategic plan with the school system. Part of that was to provide services for our community and our school families. And one component of that was to have a school-based clinic. So we have partnered with Rural Health Consortium to bring in a physician's assistant and a nurse and a receptionist here into our clinic. And made services available to our students and to our faculty, and also opened it up to students and faculty system-wide to provide health services. It's been a huge help to keep people from having to make appointments and wait in doctor's offices, and it's basically like having your own urgent care right here in the school. Typically what we normally see is, we'll have a child in class. They're not feeling well, whatever the situation is, so we send them down here. Our school nurse kind of serves as almost like a triage nurse, and she will see that student and kind of diagnose what's going on. If it's something minor, obviously we deal with it just like we normally would any other student, send them back to class or call mom, whatever we need to do. However, if it's a child who needs more attention, like for example, if it's, they come in with a sore throat, and the nurse looks and thinks, well, they might have strep throat. Well, we don't do that kind of testing here in the clinic. However, now we do with the partnership with Rural Health. So what the nurse can do at that point is call mom or dad at home and say, your child's in here with a sore throat, and looking at their throat, I really think they might have strep. The good news is you don't have to take off work. You don't have to go get an appointment. We have a clinic right here. If they don't already have the paperwork filled out, we send the paperwork home at the beginning of the year with all of our students. So if their parents choose to, they can go ahead and fill that out and send it back in. If not, in a situation like this, your child's in the clinic and they're sick, we'll call home, say, would you like for them to see the clinic? Would you fill this paperwork out? And they can come in and fill the paperwork out. Turn it in. They can be seen right here. They can get a rapid strep test. They can prescribe them the antibiotics that they need. We're again trying to just coordinate and make everything as simple as possible so that neither the child nor the parent are inconvenienced. That they can get back to class as soon as possible, and the parent can get back to work or to whatever they were doing without having a huge inconvenience during the day.
Along with convenience, the clinic provides a dynamic range of services to students and faculty.
When the patients come here, the majority of things that we see are sports physicals for students, DOT physicals for employees. We do physicals for any employment as well. We do immunizations, and we see acute care things like sore throats, allergies, tummy aches, rashes, things that you would have to miss work for to take your child to the urgent care. Now, if you are a patient of ours at our clinic, I can manage a little bit of your chronic problems like hypertension, diabetes, but those things are really more reserved for your primary care physician. Our clinic is open from 7:30 to 3:30 on Tuesdays and Thursdays, but our hope is that once the word gets out across the schools and the parents understand what a great service it is, that we will be even busier and we will be able to provide the service on every day is our goal.
Especially this time of year, what we're seeing a lot now is students advance in different grade levels. There are requirements for certain immunizations to be done. So if students come to school without those immunizations, then we have to send them back to their doctor to get those before we can admit them to school. This has been a huge help because we've had countless numbers of students from Vance, because 7th graders are one of those grades. So 7th graders have been coming over with their families and getting the immunizations they've needed, and then they're able to go right back to school that day. So it's really cut down on time out of class, which has been a huge plus for our students. For a medical provider, Rural Health really, I feel like really fits with the mission of our school system. They're not in this business to make money. They're in it to provide services, and that's what we want to do. We want to provide the best services and care we can for our students and our employees here in the school system. So it's really worked well, and it's been a good partnership.
Before I was a physician assistant, I actually was a school teacher myself in the Sullivan County school system, so I know how difficult it is to plan a doctor's appointment around a planning period, or to have to get a substitute teacher. That's a whole lot more work sometimes than it's worth, and you end up spending a lot of time after school sitting in an urgent care when you're sick. So I think that this would be a wonderful way to service our teachers as well as the whole school system, but for as long as they will have us, we will continue to do this.
If you have any questions or you would like to make an appointment, you can contact the clinic at 423-431-9827.